Let's break down some of the overlapping neurodevelopmental disorders for the EPPP and clinical practice. ADHD, autism, and SPCD are all in the neurodevelopmental disorders chapter of the DSM-5-TR, which means early onset, usually appearing in childhood, not necessarily diagnosed in childhood, but the signs and symptoms are there in childhood, and they all can affect learning and social development. First, I'll start with a brief overview of one of the newer and lesser known diagnoses, social pragmatic communication disorder, or SPCD. SPCD may present in a way that's similar to autism. So if you're meeting someone living with SPCD, you might notice those difficulties in social communication or those difficulties with taking turn in conversation, picking up on social cues, understanding context, or using language appropriately. In the DSM-5-TR, autism spectrum disorder is characterized by persistent challenges with social communication, as well as restrictive or repetitive behaviors. Language delay is no longer required to diagnose autism, and the DSM-5-TR also ditched the autism subtypes. A key difference between SPCD and ASD autism spectrum disorder is repetitive or restrictive patterns of behavior. So if you see repetitive or restrictive patterns of behavior, then that's going to be more likely an ASD diagnosis and not an SPCD diagnosis. Please remember that if the symptoms don't mess with social, academic, or daily life, it's probably not diagnosable at all. Let's talk about some of the diagnostic trip-ups between ADHD and autism. So age of onset matters. With ADHD, symptoms must be present before age 12 in order to be diagnosed, whereas with autism, signs usually show by age 3 and often between the ages of 12 to 24 months. Something to note is that ASD and SPCD are mutually exclusive, so you wouldn't find a situation where ASD and SPCD are both diagnosed. On the other hand, ASD and ADHD are very commonly seen together, so autistic people are often ADHD as well. For the EPPP, know those subtle diagnostic nuances, age of onset, and understand mutual exclusivity.